Hello and welcome. Today, we're diving into the world of eye health to explore a highly contagious condition, acute hemorrhagic conjunctivitis, often referred to as AHC. AHC is primarily caused by viruses, most commonly enterovirus 70 and Coxsackie-virus A24 variant. These viruses are highly infectious and spread easily through direct contact with infected secretions, such as tears or contact with contaminated surfaces. Once the virus enters the eye, it rapidly infects the conjunctival cells. This infection leads to inflammation and significant damage to the blood vessels within the conjunctiva. The damaged blood vessels then rupture, causing the characteristic subconjunctival hemorrhages, or bleeding under the conjunctiva, that give the condition its dramatic appearance. The inflammation also triggers the release of inflammatory mediators, further contributing to the discomfort and symptoms. AHC typically occurs in outbreaks, often affecting communities rapidly due to its highly contagious nature. These outbreaks are more common in areas with poor sanitation and hygiene practices, especially in tropical and subtropical regions. Overcrowding also contributes significantly to its spread. The signs and symptoms of AHC can be quite alarming. The most striking feature is the sudden appearance of bright red blood under the clear conjunctiva of the eye. Other symptoms include intense eye pain, a gritty or burning sensation, excessive tearing, swelling of the eyelids, and sensitivity to light, also known as photophobia. Vision may be temporarily blurred due to excessive tearing, but AHC typically does not affect visual acuity long term. Diagnosing AHC is usually based on the characteristic clinical presentation, particularly the sudden onset of subconjunctival hemorrhages along with other typical symptoms. Viral cultures or PCR testing of conjunctival swabs can be performed to confirm the diagnosis and identify the specific viral culprit, especially during outbreaks for epidemiological purposes. However, these tests are not always readily available or necessary for diagnosis in typical cases. While AHC doesn't have subtypes in the traditional sense, it's worth noting that the severity of symptoms can vary among individuals. Some may experience mild discomfort and limited hemorrhaging, while others may have intense pain, significant bleeding, and marked swelling. The specific viral strain involved can also influence the severity of the infection. Treatment for AHC is primarily supportive, focusing on alleviating symptoms and preventing secondary infections. Artificial tears can help soothe the irritated eyes and relieve the gritty sensation. Cold compresses can reduce swelling and pain. In some cases, topical antibiotics may be prescribed to prevent bacterial superinfection, although they are not effective against the viral infection itself. Strict hygiene practices, such as frequent hand washing and avoiding touching the eyes, are crucial to prevent further spread. Preventing AHC relies heavily on good hygiene practices. Frequent and thorough hand washing with soap and water is essential. Avoid touching your eyes, especially in public places or after contact with potentially contaminated surfaces. Disinfect surfaces that may have been contaminated, such as doorknobs and shared objects. During outbreaks, avoid close contact with infected individuals and practice social distancing when possible. The prognosis for AHC is generally good. The infection is typically self-limiting, resolving within 1 to 2 weeks without long-term complications. Vision usually returns to normal once the inflammation subsides. Recent research focuses on developing antiviral therapies, specifically targeting the enterovirus 70 and Coxsackie-virus A24 variants. Studies are also underway to improve diagnostic methods for rapid identification of the viral culprit during outbreaks, leading to faster and more effective public health responses.